So this is a alternative medicine extra credit for Dr. Starr's class, AP2, and we're going to talk about folic acid. So obviously we talked about folic acid and its uses for pregnancy and how it can stop spina bifida. How also folic acid has synergistic effects with certain parts of the body. But no one's ever really talked about the alternative medicinal properties of folic acid. So let's just go into what folic acid is and what it can be used for as far as nutritional value. So folic acid, otherwise known as vitamin M, vitamin B9, vitamin BC, is a form of water-soluble vitamin B9 for the most part. And it's a naturally occurring vitamin that you normally get in food. So supplementing with folic acid can sometimes be arbitrary unless you are obviously trying to prevent birth defects or you have a lack of folic acid. Folic acid derives its name from the word leaf. So as we get farther into it, we can find out that a lack of folic acid in your diet can cause a lot of interesting health problems, which most notably we know as spina bifida. But also the neural tube defect in developing embryos can be a major problem when folic acid is in low levels. But and then in adults or children, you also get diarrhea, macrocytic anemia with weakness, shortness of breath, nerve damage. Folic acid is very important for the myelin sheaths, as well as weakness, limb numbness. You have the pregnancy complications, mental confusion, forgetfulness, cognitive deficits, mental depression, sore or swollen tongue, peptic and mouth ulcers. So you get the idea. Folic acid's got a plethora of very important things that it does to help the body function appropriately. But what happens when you oversaturate with folic acid so you can try to solve other issues? We see that folic acid has been a necessary augmentee for pregnancy. We find that people that have infertility problems normally take folic acid to help them to conceive, give birth, because folate is extremely necessary for spermatogenesis, as well as polymorphisms in the genes and enzymes, which can help to explain some of the unexplained fertility issues that can happen. Moreover, folic acid appears, not necessarily, there's more research needs to be done, but folic acid appears to prevent or reduce the risk of strokes due to the fact that folates play a very interesting role in homocysteine concentration. What that essentially helps us to understand is that folic acid can give us a better. Well, let me backtrack for a second. This is not in any way saying that folic acid 100% of the time prevents a stroke, but it can help reduce the risk of a stroke if given in larger quantities than you would find in a dietary normal diet. Going into further ideologies behind the use of folic acid in alternative medicine, we can use it for psychological effects, as it is shortage of folates is linked to depression. We also enjoy the idea that folic acid has a low risk for toxicity in the body, so taking large amounts of folic acid or in folates won't cause any type of change in homeostatic control. We also found that there's a study that's been done that links folic acid to a decreased risk for developing age-related macular degeneration. And it is a significant decrease in macular degeneration in age-related cases of up to 34.7%. But the most interesting aspect of folic acid, and as I conclude, I will go into this more than the others, is that folic acid in and of itself has interesting properties that can help can help. There's still more research being done, and right now it's promising but not been verified that folic acid can help reverse the toxic effects of chemotherapy. So you have anti-folate chemotherapy where folates, they help the mitosis of cells because cancer cells divide rapidly, and drugs that interfere with folate metabolism are used to treat cancer. So essentially, the idea behind this treatment is to attack cancerous cells and deny them access to folic acid. They've also tried to introduce folic acid supplementation in cancer patients, and as I said, it showed promise, but it's not necessarily, it's hit or miss, it's mixed results. And so, we found that diets high in folates decrease the risk of colorectal cancer, obviously cancer in the colon region of the body. And some studies have shown that higher concentrations of folates in foods alone are better than supplements, pill form, things of that nature. But when doing a broader scope of folate intake, there is no statistical evidence to prove that extra intake will help with the other cancers. But good news all around. So folic acid. A lot of times we overlook some of these key vitamins and nutrients that we find in most of our foods, but you'll find that folic acid in and of itself can have a very interesting supplemental effect if taken in higher concentrations for different things that are important for body function. So the last piece of this that you might be important for everyone to understand is that folic acid has an interaction with B12 and iron. And you'll find that a deficiency in one of these antagonistic vitamins will show a lack of homeostatic control in the body and can be a signifier for some type of disease or viral infection, as all three of these must be in balance. And you'll find that throughout the entire body, mostly, as we've learned before. Well, this is Francis Fiske, and this concludes my alternative medicine extra credit.